Breast cancer in men is rare, making up less than 1% of all breast cancer cases. Around 1 in 1,000 men will be diagnosed in their lifetime. Male breast cancer starts when cells in the breast tissue grow abnormally. Although men do not have as much breast tissue as women, they still have some which can develop cancer. Look out for symptoms such as a lump in the breast area, nipple discharge, or change in the nipple or surrounding skin. If you notice any of these signs, it's crucial to see a doctor immediately. Early detection is key. Your doctor can perform tests like a mammogram, ultrasound, or biopsy to check for cancer. Risk factors for male breast cancer include age. Most cases occur in men over 60, family history, genetic mutation, radiation exposure, and certain hormonal imbalance. Maintaining a healthy lifestyle can help reduce your risk. This includes regular exercise, a balanced diet, and avoiding excessive alcohol. Treatment options for men are similar to those for women and may include surgery, radiation therapy, chemotherapy, and hormone therapy. Remember, breast cancer in men is rare but serious. Awareness and early detection can make all the differences. Thank you for watching, stay healthy, and see you next time.